The benefits of healthcare choices shows that if families control their healthcare dollars, they can shop for the best care and coverage. They can choose the direct pay options or cash-friendly clinics, and they can keep more earnings instead of subsidizing inefficiency, bloated healthcare that doesn't innovate as well as it should. Hello, welcome to this week's Economy. I'm your host, Dr. Vance Ginn. Thank you for joining me again today. It's great to have you with me. We've got a lot to talk about, and specifically about healthcare. America's healthcare system is the most expensive in the world, costing nearly $5 trillion annually, almost $15,000 per person. Yet, despite that staggering price tag, millions of Americans still struggle to access basic care. Routine procedures are delayed for months, providers are buried in bureaucracy, and even those with insurance often feel powerless and frustrated. If healthcare is meant to help people heal, our current system is failing. So, how do we get here and what can be done to fix it? Well, that's precisely what I'm going to tackle in this week's episode of This Week's Economy. We'll explore the roots of a broken healthcare system and the path to empower patients. Well, how do we get here? Here's a little bit of background. Today's distorted healthcare market has its roots in World War II era price and wage controls. To attract workers without violating wage freezes, employers began offering health insurance as a fringe benefit, one made more attractive by a special tax advantage, of course, by the federal government. Even after the war and the repeals of wage controls, many of them, this tax break remained. But instead of restoring insurance costs to workers' paychecks so they could choose how to spend the money, employers continued directing those funds into insurance plans and premiums. This resulted in a system where health insurance is tied to employment and where employees are largely cut off from making their own healthcare decisions. This is not right. So that system has ballooned and perpetuated into a bloated and inefficient mess. My upcoming research and book with Dr. Dean Waldman reveals that 31% to 50% of all healthcare spending, which is up to $2.5 trillion annually, is wasted on non-clinical overhead. So, where does that money go? Not to patient care. It's consumed by what we call burden. BURRDEN. That stands for bureaucracy, unnecessary rules, regulations, red tape, directives, enforcement, mandates, and non-compliance costs. Many Americans believe employer-sponsored insurance is a generous benefit, but it's part of their compensation, just compensation they can't control, right? Roughly 165 million Americans depend on employer-provided or sponsored insurance, yet most workers have limited one-size-fits-all options. Take a worker in a 33% tax bracket. They might avoid nearly $7,910 in federal taxes on a typical family plan. But this quote-unquote tax break obscures the real harm: less choice, less competition, and higher prices system-wide. The future is what we need: real healthcare reform. It's not going to be easy, but it's essential. The current system was built to serve institutions, not individuals, not patients. Subsidies, mandates, and bureaucracy sustain it, not patient needs. We propose a simple but powerful shift. Give workers control. Redirect the tax advantage payments flowing to an insurer and to employers into employees' hands. Let individuals use that money to buy coverage, pay medical bills, or save for future care. When people, not institutions and government, control the money, they can demand better care at better prices. Imagine that. Well, step one, return money spent, or health insurance, that is, to we, the people. Here are the principles for that. Well, employers are diverting an average of $24,000 per worker annually to health insurance companies through tax advantage employer-sponsored health plans. That money never shows up in a worker's paycheck. It's spent by a third party, often with no knowledge of or accountability for the employee's personal health care needs, right? The solution here is to put money in patients' hands if we're going to keep this process going. Instead of giving that non-taxable $24,000 to health insurance companies, allow workers to keep their non-taxable money to spend on health care, insurance premiums, direct pay services, or savings for future medical expenses. The benefits of healthcare choices shows that if families control their healthcare dollars, they can shop for the best care and coverage. They can choose the direct pay options or cash-friendly clinics, and they can keep more earnings instead of subsidizing inefficiency, bloated healthcare that doesn't innovate as well as it should. Real choice allows them to shop for better care, select the coverage that fits their needs, and avoid networks that limit access. Lower costs with direct pay options and cash-friendly clinics thriving in a consumer-driven system will be better. Greater control to see and own the full value of their compensation rather than subsidize inefficiency and waste. It's ridiculous, guys. The bottom line is this money belongs to workers, not insurance companies, not the government. Giving people control over their healthcare dollars is simple, powerful, and long overdue first step toward real reform. Step 2, establish the no-limit HSA. What this can help do is really start to bring about more innovation. Today's healthcare savings tools feature HSAs, FSAs, MSAs, and fragmented, confusing, and arbitrarily restricted programs. Some come with use it or lose it conditions. Others are tied to specific insurance plans or capped by the IRS, state, or employer limits. This creates a system that restricts patient flexibility and discourages smart healthcare spending. What should we do instead? Well, that's where the no-limit health savings accounts come in. This account will replace the current patchwork of healthcare savings tools with a single, simple option that allows unlimited tax-free contribution, eliminates use it or lose it rules, is transferable across family members and generations, covers any medical care the patient deems necessary. The benefits to this is that when people control their healthcare dollars, they become value-conscious consumers, helping to drive down prices and quality up through increased competition. Models like direct primary care or DPCs and cash-based surgery centers already show what's possible when competition is unleashed. This leads to true choice, as insurers, employers, or bureaucrats can no longer gatekeep. Patients choose their doctor, care, and how to spend their money. The bottom line here is a no-limit HSA would unlock innovation, reduce costs, and restore trust in a system that feels rigged against patients. It's time to replace complexity with clarity and control. We got to have more about this, and I'm going to talk about this in my new book with Dr. Dean Waldman, Empower Patients, 2 Doctors, Cure for Healthcare. We unpack the benefits and practical applications of no-limit health savings accounts and much more, and how it can transform the system from the ground up. Don't miss it. Step 3, block grant Medicaid and transition Medicare. This is something that's also going to be crucial for all this. We can't fix healthcare without addressing the major drivers of cost and dysfunction, Medicaid and Medicare. These programs are not only distorting the market, they're also major factors pushing our national debt to unsustainable levels. Medicaid is already in the spotlight during ongoing budget reconciliation debates and the One Big Beautiful Bill sort of act in Washington. Proposals like work requirements, spending caps, and efficiency reforms are being considered. These are good, but these measures fell short of the transformational change we're ultimately going to need. Well, we need our Medicaid reforms. We propose in this Empower Patients initiative, replacing top-down federal control with a block grant model that gives states full authority to tailor their Medicaid programs. That means block granting federal Medicaid funds to the states, letting states then to determine eligibility, benefits, provider networks, and patient incentives, allowing partnerships with private charities, faith-based groups, and local clinics. And you also should replace federal micromanagement with state-level innovation. And Medicare reforms, look, we need a forward-looking transition that moves Medicare away from centralized control and toward consumer-directed care. This includes giving seniors the option to deposit Medicare funds into a senior no-limit HSA, letting them shop for care in the private market backed by real patient-owned funds. The trade-off, yes, reform may require short-term spending increases, which I don't like as a fiscal hawk, neither does Dr. Dean, but this is essential even though we are fiscal hawks. With the Medicare Trust Fund projected to go insolvent very soon, maybe by 2036, inaction is not an option. Spending increases should be offset by cuts in wasteful areas and replaced with a sustainable system that promotes competition, personal responsibility, and better care through no-limit HSAs. A decentralized, patient-focused model will deliver better outcomes and ensure the long-term survival of programs millions of Americans depend on if we want to keep them at all and return more money to taxpayers. Why not do that? Check out for more of these details in my latest report, Dr. Dean Waldman at Americans for Tax Reform, and where we can make these changes and benefit those that are needed in the process. Don't miss that. Step 4, free the insurance market. Here's the principle here. The employer-sponsored health insurance distorts the market and inflates costs. It encourages over-insurance while limiting individual choice and suppressing competition in a true free market. Individuals and choice should be able to shop for insurance like any other product based on value, need, and personal preference. Insurance should exist to manage financial risk, not to dictate or micromanage care like it does today. The solutions then is that what insurance should do, right, is cover catastrophic events, not routine expenses. Just as we don't expect auto insurance to pay for every oil change, health insurance shouldn't cover every doctor visit or minor procedure. Patients, not bureaucrats or employers or government, should decide which policies meet their needs best. Our recommendations for this is that we should eliminate federal mandates that restrict plan design and innovation, allow insurance sales across state lines to foster competition, expand access to catastrophic only and wraparound plans, and let innovation, not Washington and bureaucrats, determine winners and losers in the marketplace. And insurance should provide and make sure they empower patients, not control them. A free and open market would reduce cost, expand choices, and restore the doctor-patient relationship that's missing today. If the government stepped back and got out, the market will respond with a diverse range of affordable, customized plans. Young, healthy individuals could choose low-cost, minimal coverage plans like they used to. Seniors could use their no-limit HSAs for concierge or direct primary care visits. Employers could offer higher wages in place of bloated, one-size-fits-all insurance. Customers would have real choices, not just the illusion of them. A real cure starts with real choice. We need to really get this in mind because healthcare reform won't be easy, but it's absolutely necessary. Our current system, propped up by subsidies, mandates, and bureaucracy, was never built to serve people. It was built to serve institutions. Real reform begins by restoring healthcare as a direct exchange between those who provide care and those who need it. Everything else, government, mandates, insurance, red tape, endless compliance paperwork, is noise. It drives up costs, reduces access, and strips patients of control of their health. Our book and new report on the Empower Patients Initiative will offer more than just critique. Dr. Dean Waldman and I outline a clear, actionable roadmap to put patients back in charge. The sooner we start, the sooner Americans will receive the care that they actually need on their terms. It's time to stop pouring more money into a broken system. It's time to empower patients and to let people prosper. Right. So go and check it out. Buy the book. Read the report. 50% of all proceeds of our book, if not more, will be donated to the Canine Companions for Independence that helps out veterans. Thank you for supporting this cause. And I hope that you'll go and check all these out. It's really important. I think you'll really enjoy it and you'll be able to take something home and understand what we're talking about here and hopefully share with your friends and family and to others who can make a difference as well. So thanks for joining me in this episode of This Week's Economy. For more insights, visit vanceginn.com. And for even greater value, with a paid subscription to my Substack newsletter at vanceginn.substack.com. You can also get a complimentary subscription if you'd like. Thank you for joining me today. Please share with your friends and family. And until next time, God bless you and let people prosper.